Hey guys, welcome back to my channel. I'm so excited to be here. If you're new here, I'm Dr. Lada, a family nurse practitioner. I do YouTube videos and yeah, welcome to the family. So first of all, I'm excited to be back. So the other day I was on the internet and I cannot remember why or how this opportunity popped up, but I knew immediately that I wanted to share it with you guys. So let's get started. This video will be really beneficial for nurse practitioners who are graduating in the spring of 2022. And also for recent graduates who are looking for a job, and for nurse practitioners who graduated, sometime during this pandemic and you have yet to find a job and you're kind of worried about your skills. I have heard from some people that being a brand new nurse practitioner can present some challenges. So yeah, I'm here to help you guys out. This video is not sponsored and I have absolutely no affiliation at all with the company I'm about to talk about. I'm just here to tell you guys about the opportunity, and then I do expect you guys to do your own research. Go to the Zoom call that they have coming up. Go and look at the pre-recorded Zoom call. It's like an hour, because there you will really find all of the information you're looking for. I'm just giving you guys some information on an opportunity, but I do expect you guys to do your own research. I always tell you guys that. And I expect you guys to go to the website, to read the information for yourself, to go to the pre-recorded Zoom call, and you will get so much information from that. It's like an hour long. And there's also an upcoming Zoom call in January 6th at 5:30 Central Standard Time. So I ran into this program that Oak Street Health has started, and it looks like a residency to me, a nurse practitioner residency, but that's not what they call it. They call it the Oak Street Health Nurse Practitioner Fellowship in Adult Primary Care. So to me, it's the same thing as a residency. So with this fellowship, they are building on your graduate education, and they're helping you to transition into confident and competent clinicians. And I tell you, that's what we need. If I was just out of school and had this opportunity, I would jump on it. Because the scariest thing is when you graduate and you're a fresh new baby NP and you feel like you're just thrown to the wolves. That's never fun. It's actually terrifying. And you guys know that I was blessed and I lucked out because I had someone take me under her wing and just really show me the ropes and just support me. So for you guys to have an opportunity to get into a fellowship program and be paid for doing it, it's really a great opportunity. So let's talk more about the opportunity, what this fellowship program is. I will make this kind of a short video because I want you guys to do your own research. I want you guys to go to the website and look it up and make a decision. I'm here to present it to you guys and just tell you guys what I saw. And I do expect you guys to come back and let me know what you think, or comment below. Let me know what you think. Let me know if you applied. So let's talk about it. Let's talk about it. This fellowship program, what we're looking for, or what they are looking for, they're looking for 12 adult or adult gerontology nurse practitioners who graduated or will graduate from their training program between August of 2021 and May of 2022. Now, in the Zoom call that they had, they said that if you had already graduated, that they would still consider you. And they also said they understand that with COVID and everything, some new nurse practitioners have had difficulty finding employment. So they did say in the Zoom call that they will be willing to accept nurse practitioners who graduated, but they haven't found a job yet. So if you don't have any experience, you should still apply. And it just felt so weird during the Zoom call when they kept saying, yeah, we want people who don't have experience. We want brand new NPs, because I hear nurse practitioners say so much like, I see jobs, but they want someone with experience. Well, now, sis, they want you. They want you without experience. So here's the other thing. And this might be bad for some people, but this may be good for some people. I don't know. But you have to be willing to live in Chicago, Dallas, Greensboro, or Philadelphia for the program duration. The program is 12 months. And those are the 4 places where it's going to be held. Now, keep in mind that Oak Street Health is a pretty large organization. They have about 120 sites, and they are growing. In the early part of 2022, they're opening a new site in Arizona. So they are growing. They are in about 20 states in the US. And again, they're growing. So if you do the fellowship program, which is 12 months, then they were mentioning in the Zoom call that the company would allow you to relocate to any of the states if the opportunity was present and you needed to. So keep that in mind that, once you're done with the residency program, if you see another site that is hiring and they're with Oak Street Health and they're in a different state, you will be able to apply for that position, to apply for a transfer. You have to have a minimum of a 3.0 GPA in the NP program. And I really don't think this will be a problem for any of you guys, because you need to have a 3.0 to graduate. At least in my nurse practitioner program, you needed a 3.0. So I think that will be an easy thing to check off of your list. It currently holds, or will hold, by September 6, 2022, an active non-probationary state NP license. You need a genuine passion for primary care, a supportive attitude toward our patient population of older adults. Okay, that's something else we need to talk about. This company specializes in treating patients in medically underserved areas. The average age is like 65 or older, and these patients usually have Medicaid and Medicare. There are some, I think they said most of their patients are 65 or older, but of course sometimes there are exceptions for people that have chronic illnesses or whatever that have qualified them. So if you're a nurse practitioner and you have experience and this sounds like something you might be interested in, you could still go to Oak Street Health and just look up and see if any of the sites are hiring. They have so many sites that I'm pretty sure they're hiring somewhere. They have over 120 sites across 20 states in the US. So that's pretty impressive. This is a pretty huge company. Let me tell you guys a few more things that I got from the Zoom call. This fellowship program is 12 months. The applications are due by January 24th, 2022. So if you want to be a part of this, you really have to get moving on that, because you have about a month to get your application in. The first round interviews will be conducted virtually in February of 2022. The second round interviews will be virtual or in person. based on the applicant preference in March of 2022. Final decisions will be delivered by April 15th, 2022. So by April, you will know if you've been selected. And I know that they're only accepting 12 applicants. And that may deter some of you guys. That may make some of you feel like only 12, I'm not even going to apply. You know how I feel about not taking chances. Same thing I've always said with the loan repayment programs. Yes, it's competitive, but that doesn't mean that you won't be selected. So give yourself a chance. Apply for the program. Like, the only thing you're going to lose is a little bit of time. And again, this goes for people who are interested. This goes for people who are willing to relocate or people who already live in those areas that we talked about. They also noted that applicants may choose to apply for a specific city or cities, or just be considered for all 4 areas. If you're just like, you know what, I can move. I'm willing to do this fellowship program in any of the areas, whatever, just give me a chance. So you can put on there that you don't have a preference. Another thing, let me grab my phone. This is a paid opportunity. Now, let's talk about money. So you do not get 100% of what NPs make. They pay 80% for the 12 months of the fellowship program. So they were pretty upfront in the Zoom call. They said that you would make about $88,000 for the during the 12-month program. And then after the 12-month program, you do have to stay with them 1 additional year, and you would have a full NP salary that 2nd year. During the fellowship program, you are eligible for health insurance, dental insurance, disability insurance, and 401k. They match a percentage, so you still get all of those benefits, which is great. I want you guys to keep in mind that the $88K that you make the year of the fellowship program, if you think about it, it weighs out a little bit because they literally hold your hand and slowly introduce you into independent practice. So that's great, because the anxiety, the stress that you're under when you feel like you're alone, it can be overwhelming. So just keep in mind, weigh your options. Some of you may say, nope, I don't want to do a fellowship program. I never want to make $88K. I need to make 6 figures starting out. If that's the case, then I totally understand. We have to do what's best for us. But for some of you that feel like, you know what, no, this is a golden opportunity. It's 12 months, $88K for 12 months, but I have all of these other benefits. And I'm feeling this. I like this. Some of the other things I got from the Zoom call, you have access to UpToDate. You guys know I love UpToDate. I love my resources. And they talked about the importance of having evidence-based resources and great resources. They pride themselves in being more concerned about value and quality of care over quantity. They say that you'll have a smaller panel. And this is when you're out of the fellowship program, because in the fellowship program, if I'm not mistaken, you see a patient, there's a block, see a patient, there's a block. You have your preceptor there, so you're not on your own. And then for people who are employed for Oak Street Health, they have a smaller panel. The average PCP panel is 2,500 compared to the Oak Street average of approximately 400 to 500. So that's a big difference. Less patients per day. 20 and 40-minute visits and an average of 12 patients per day. And they talk about how just a regular visit is 20 minutes, but if you have a physical or a hospital follow-up or some like intense visit, it's 40 minutes. Panel management, dedicated time weekly with care team for panel review, complete care team, so full-time scribe. Everybody gets a full-time scribe. That's amazing. Registered nurse, medical assistant, medical social worker, and then there's also telepsychiatry, on-site behavioral health services, on-site podiatry, and many others. After you are done with the fellowship program, you're eligible for bonuses. So that second year where you're paid 100% as a nurse practitioner, then you are eligible for bonuses, and those bonuses are based on quality, not quantity. And when I was listening to the Zoom call, they talked a lot about when they're looking at quality, they're looking at, has this patient had their mammogram? Have they had their colon cancer screening? And, you know, they're weighing quality over quantity. And I think that's a pretty good model to adopt. Let me tell you guys a little bit about the Oak Street centers. So they're located in medically underserved communities where primary care access is limited, and the neighborhoods they serve tend to be lower income, and more than 40% of their patients are dual eligible for Medicare and Medicaid. I'm gonna post below the website. You guys can just go there to the website and you'll see the pre-recorded Zoom call. And I really advise you guys to just take an hour and listen to that. And there's an upcoming Zoom call on Thursday, January 6th at 5 p.m. Central Standard Time. You can register for that. And that will be their final virtual information session, and you'll be hearing from a program director. So if you are familiar with this company, comment below, which will help everybody, especially people who are interested. And if you find out additional information, comment below. You know, let's help each other. I feel like I've told you guys a good bit about this program. Again, this is a fellowship program through Oak Street Health, and I just wanted to kind of put this out there for nurse practitioners who are graduating in May of 2022, for new NPs who have not yet found anyone that's willing to take a chance on them, and for NPs who are like, whoa, this sounds like a great company, I'm interested in working for them. Just look up Oak Street Health and just look up employment opportunities with them. But yeah, I hope this helps some of you guys. It was really on my heart to do this video because I feel like it'll help somebody, you know? And guys, you know, have faith in yourself, believe. If you are searching for a job and this is not a good opportunity for you, let me just take this moment to say, don't give up. You have the education, you have the skills, you have the knowledge. So continue to look. And in this day and age, we're creating opportunities for ourselves. So keep that in mind as well. Thank you for being here. Thank you for being a part of my little tribe. And I appreciate you guys so much, and I love you guys so much. Please leave comments below. Share this video with anyone that you think would be interested in this opportunity, because guys, this is a golden opportunity. But let me know what you guys think. Comment below, and yeah, I will see you guys in the next one. Love you.